This is, and I'm just going to sit here, somebody's monitoring blood pressure, and just slightly let air out of this. Take about 5 or 6 minutes to let this air out, 5 to 10 minutes. Why so slowly?
Because you don't want to alter his...
Yeah, exactly right, because I don't want to let it out all at once and lose everything we got. So we do this section, then we do one leg, then the other leg, and that should take about 15 to 20 minutes to totally deflate these if you have totally inflated from the time that you start deflating. Does that make sense?
And are you checking his blood pressure more than every 5 minutes with this thing?
Yes, you're continuously monitoring his blood pressure. You know, as you're letting this down, you start about halfway through, you monitor blood pressure, and then when you get through, you monitor blood pressure. So it's about every 2 or 3 minutes, you know, based on the time frame. All right. Now, yes, you go ahead and take those off. Okay, so we got our IVs, they're still going. We got our MAST Trousers, you know, now we're going to take them off. So there's a couple different ways we can do that. You know, hospital says, hey, we want to take them off. All right, so just unfold them. Okay, lift his legs up. Somebody just slide him out from there. There you have it. Now, clean those with soap and water and go from there. That's usually for hypovolemic shock. To use those MAST Trousers for lower extremity, painful swollen mishap deformities, where we have bilateral femurs or hip or tib field or whatever, you puff them enough, you put enough air in them so you can push in and you can still touch the skin. Does that make sense? You don't want them real tight. You just where you can push in. Does that make sense? All right. How do we clean those? Soap and water. Okay, soap and water. They're not used for abdominal eviscerations because obvious reasons. You don't want to push the content stuff back down, but you can use the leg section. So for abdominal eviscerations, where you got a big painful cut across the abdominal cavity, you know, intestine stuff hanging out, you don't want to use those. You don't want to use them for long bone compound fractures where the bone has come through the skin. You don't want to use them for that. So that's a couple of limitations. But anything else is pretty much good to go. Head trauma, pulmonary edema, very contraindicated. Any questions about the MAST?
What are the odds of the patient coming to as we apply this?
They will. I actually had a guy one time, he was dead, didn't know it. He was as white as your shirt, and he come up wanting to fight. We put him on, he literally come up wanting to fight. He's 22 years old. Then, you know, he bled out. The time we got to the hospital, he bled out and he died. But, I mean, you know, but literally he was wanting to fight. He was combative. Just because of the MAST Trousers. So, yeah, they do work, but you'll hear a lot of controversy. A lot of services around here do not use them. Y'all use them? Brandon, y'all don't use them anymore?
We don't even carry them on trucks anymore.
Most all the trucks don't have them anymore. They was took off about 8 to 10 years ago. But you may see an increase. Some services still use them because their medical director says they work. Here's why they took them off. If you have a bleed, right, and you increase the pressure on that bleed, what are you doing?
You're cutting the circulation.
You're increasing the bleed. You're just forcing it. It's just like a hose pipe. If you got a leak in your hose pipe,
stand on it,
and you kink it,
it's
exactly right. Basically the same thing. So that's why they say it don't work. There's somebody with more letters and numbers behind their name than mine come up with that idea. But you know, real world, I've seen them, you know, actually do some good. Now, for pelvic fractures and things, lower extremity, they work real good.
So we don't use tourniquets or anything like that?
Yes, for bleeding, you use tourniquets. Yep. Direct pressure and tourniquets, that's the last resort. Those are the only 2 options we got for controlling external bleeding, other than MAST Trousers.
You don't do pressure points no more?
No, they done away with that. And we just learned that back in July. That was one of the changes they made. And you know what brought that about? The war in Afghanistan. Yeah. You know, why go through that step when it ain't working when you go into tourniquet anyway, so that's why they kind of alleviated all that. All right, so if we fold those up, put them back in the box. What time do we have? Pretty much stuck, sorry. When we start getting more bleeding and stuff, then a lot of these things will come about as far as they're concerned. And just Velcro back to the stuff. Did you get all your stuff?
Yeah.
And let's put all this board stuff back in the closet and just kind of pick that stuff up.
MAST Trousers back to the